When our service members return home from their deployments, they often carry more than just their gear and memories. Many bring back invisible wounds that can deeply affect their lives long after their service has ended. These are injuries to the brain and mind, conditions like post-traumatic stress disorder or PTSD, and traumatic brain injury or TBI. These challenges are not signs of weakness but are medical conditions resulting from the intense and often dangerous environments they have endured. Their experiences, from combat exposure to the constant stress of being on high alert, can leave lasting marks that require our attention and the very best care we can provide for them. Let's break down what these conditions are in simple terms. Post-traumatic stress disorder, or PTSD, is a condition that can develop after a person goes through a shocking, scary, or dangerous event. For a veteran, this might be a firefight, seeing a friend get hurt or being in a place where danger was always present. Their brain gets stuck in a state of high alert, causing nightmares, flashbacks, and severe anxiety. They might feel emotionally numb or avoid places and people that remind them of the trauma. It's like their internal alarm system is broken and won't turn off, making it incredibly difficult to relax and feel safe again in everyday life. On the other hand, a traumatic brain injury, or TBI, is a physical injury to the brain. This can happen from a blast wave from an explosion, a hard fall, a vehicle accident, or any impact to the head. Even a mild TBI, sometimes called a concussion, can cause serious problems. Veterans with TBI might experience headaches, dizziness, memory loss, and difficulty concentrating. Their personality can change, leading to irritability or depression. Unlike a broken arm that can be set in a cast, a brain injury is complex and affects the very core of who a person is, controlling their thoughts, emotions, and actions. The struggles for veterans with PTSD and TBI are immense and can ripple through every aspect of their existence. Finding and holding a job can become a monumental task when concentration is difficult or anxiety is overwhelming. Relationships with family and friends can become strained as the person they once were seems to have changed. The world can feel like a hostile and confusing place. This is why it is so critically important for us to understand these invisible wounds, not as personal failings, but as treatable medical conditions that deserve our compassion, our research, and our unwavering support. Fortunately, we're living in an era of incredible medical innovation, and this extends to how we treat the brain. Scientists and doctors are developing new brain therapies that offer real hope to veterans struggling with PTSD and TBI. These advanced treatments go beyond traditional talk therapy and medication, using technology to directly interact with the brain's activity. The goal is to help the brain heal itself by rewiring the circuits that have been damaged by trauma or injury. Think of it like a physical therapist helping a patient retrain their muscles after an injury. These new therapies help veterans retrain their brains to find peace and function better. One of the most promising areas is the use of sophisticated brain imaging and targeted treatments. For example, doctors can now use advanced MRI scans, like functional MRIs, to see which parts of a veteran's brain are overactive or underactive when they think about their trauma. This gives them a precise map of the problem area. With this information, they can apply targeted therapies like transcranial magnetic stimulation, or TMS. TMS is a non-invasive procedure that uses magnetic fields to gently stimulate specific nerve cells in the brain. For a veteran with PTSD, this could mean calming the fear center of the brain and strengthening the areas responsible for emotional control and logical thinking. Let me share a story that illustrates the power of these new approaches. Consider a former army sergeant I'll call Mark. After 2 tours overseas, he came home with severe PTSD. He couldn't sleep, loud noises sent him into a panic, and he felt completely disconnected from his wife and kids. Traditional therapy helped a little, but he was still struggling. His doctor recommended a course of TMS therapy combined with virtual reality exposure. In a controlled, safe environment, Mark used VR goggles to revisit scenes that triggered his anxiety, while the TMS machine helped his brain regulate its fear response. Slowly but surely, the nightmares lessened, and he started to feel more present and engaged with his family again. These breakthroughs are changing the conversation around mental health for veterans. They are moving us away from a one-size-fits-all approach and toward personalized medicine for the brain. Other examples include new types of medications developed based on a deeper understanding of brain chemistry after trauma, and biofeedback therapies where veterans learn to control their own physiological responses, like heart rate and breathing, by watching them in real time on a screen. These tools empower veterans, giving them an active role in their own healing process and providing tangible evidence that their brain can and will get better with the right kind of help. To truly appreciate how far we have come, it is helpful to compare these advanced treatments with the older ways we used to handle these conditions. In the past, the primary tools for treating PTSD and TBI were quite limited. For many years, the main approach was talk therapy, such as cognitive behavioral therapy, combined with antidepressant or anti-anxiety medications. While these methods have helped countless individuals and remain valuable today, they don't work for everyone. Some veterans find it too difficult to talk about their trauma, while others experience significant side effects from medication or find that it only dulls their symptoms instead of resolving them. The older methods often treated the brain like a black box. A doctor would prescribe a medication and hope it would have the desired effect on the brain's complex chemistry, but they couldn't see exactly what was happening inside. Talk therapy relied on the veteran's ability to articulate their experiences and consciously change their thought patterns. These treatments were essentially working from the outside in. They were important first steps. But for those with severe treatment-resistant PTSD or the cognitive difficulties from a TBI, these approaches could sometimes feel like trying to fix a complex engine with only a basic wrench and a screwdriver. Now, the new frontiers of brain therapy are working from the inside out. Advanced neuroimaging allows us to see the problem directly, identifying the specific circuits that need repair. Treatments like TMS, neurofeedback, and even experimental therapies using psychedelics in controlled clinical settings are designed to physically change the brain's structure and function. They can promote neuroplasticity, which is the brain's amazing ability to reorganize itself and form new connections. This is a fundamental shift from simply managing symptoms to actively promoting healing at a neurological level. It's a more direct and targeted approach to brain health. This evolution in treatment represents a monumental leap forward. Instead of relying solely on a veteran's subjective report of how they feel, doctors can now use objective data from brain scans to guide and personalize treatment plans. If one approach isn't working, they can adjust it based on what the imaging tells them. This doesn't mean we should discard older methods. In fact, the most effective strategies often combine new and old approaches. A veteran might use TMS to calm their hyperactive fear response, making it easier for them to then engage productively in talk therapy. The new tools are expanding our toolbox, giving us more ways to win the fight. Ensuring our veterans have access to the best possible treatments for brain health is more than just a medical goal, it is a moral obligation. These men and women have put themselves in harm's way to protect our freedoms, and the injuries they sustain, both visible and invisible, are a cost of that service. When they return, it is our collective responsibility as a society to provide them with a pathway to healing and wholeness. Failing to do so not only betrays their trust, but also wastes the immense potential and experience they bring back to our communities. A healed veteran is a strong leader, a dedicated employee, and a present family member. Investing in advanced brain therapies for veterans also has benefits that extend far beyond the military community. The research and development in this area pushes the entire field of neuroscience forward. The discoveries made in treating a veteran's TBI can lead to better treatments for athletes with concussions or for elderly patients with cognitive decline. The insights gained from treating PTSD can help us better understand and support survivors of natural disasters, accidents, or violent crime. By focusing on our veterans, we are pioneering medical technologies and therapies that will ultimately help everyone, creating a healthier society for all. Furthermore, offering effective, cutting-edge care helps to dismantle the stigma that has long surrounded mental health, especially in military culture. When veterans see that PTSD and TBI are being treated as serious medical conditions with sophisticated, science-backed solutions, it encourages them to seek help. It sends a powerful message that their struggles are real, they are not alone, and there is genuine hope for recovery. This shift in perspective is crucial for creating a culture where asking for help is seen not as a weakness but as an act of courage and a vital step toward reclaiming one's life after service. Ultimately, the mission to heal our veterans is a reflection of our national character. It is about honoring the promises we have made to those who serve. By embracing and funding these breakthrough brain therapies, we are giving our heroes the one thing they need most, a credible chance to come all the way home. It ensures that their service does not end with a lifetime of suffering, but with a future filled with peace, purpose, and well-being. Their sacrifice was for us, and our commitment to their healing must be unwavering. It is the very least we can do to thank them for their service.